Welcome back. About 19 million Americans are affected by depression, according to some medical studies. In South Bend, doctors are using a new treatment that doesn't involve antidepressants and has the approval from the Food and Drug Administration. Joining us this morning in the studio is Dr. Ahmad Almadawi with Beacon Health. Good morning.
Good morning, Denise.
Okay, tell us about this program, TMS. What does that stand for and how does it work?
So TMS, or transcranial magnetic stimulation, is actually approved by FDA since 2008.
Okay.
It's local treatment. It's actually does not involve medication. It's basically using an MRI strength magnetic field by using a magnetic coil, as pretty much like you see it in the video we have. It's actually placed over like a patient's head and radiate magnetic strength to stimulate the brain, and in an area we believe it's responsible or involved in depressions. So,
and how long have you been offering this treatment? How many patients do you have?
So we started the program since last year, like summer last year, and so far I think we have over 50 patients.
Wow. And
it's amazing how we see patients before they start the treatment. It takes 5 to 6 weeks. And in the initial phase of the treatment, patient will maybe complain of depression, and they have like depression scale up to like the score is very high. Over the treatment, they go through like a full remission by end of 5 to 6 weeks. And it's kind of like the advantage over medication, you don't have the side effects.
I was just going to ask, are there any side effects?
Well, the most common side effect of TMS is like discomfort in the scalp, because it's localized treatment. We avoid all the side effects you could get from systemic treatment or traditional antidepressant treatment, as patient may actually experience over time. So the only side effect we know of is like discomfort, and that's pretty much it. There is no pain involved. Wow. No anesthesia involved. It's an outpatient procedure.
How long is each treatment?
So it's an hour, and it's Monday to Friday for 5 to 6 weeks. The first treatment is the most important treatment, as we right now have more knowledge about the different area of the brain and different function. We even have more knowledge about the brain circuits. Okay. And each circuit's responsible for certain like responsibility or emotions or feelings. So the more precise we localize the treatment, the best results we get. So the first treatment, we have to localize the treatment, the place we're going to treat, and we apply the same location for the 5 to 6 weeks. So. And
doctor, if people are interested in exploring this as an option for them, how would they go about doing that? So
the process, we build the TMS program where we have to have very careful screening for all patients with depression, because right now there is research about using TMS in different even anxiety brain disorders or ADHD, and for a child psychiatry field they use it for autism sometimes. Okay. So it has like a wild usage, but the only FDA approved treatment for depression. So they first
they come in and kind of do a screening process.
A screening process. Then I meet with the patient for an hour and a half for an assessment and evaluation. I see if TMS will be an option for them.
Wonderful. Thank you so much for coming in this morning, doctor. We appreciate it.
Thank you.